Just because time has passed since surgery does not mean your knee should be pain free. And I hear this all the time. I see people who have this expectation and they've had a meniscus repair, maybe they've had a ACL reconstruction, a total knee replacement, any knee surgery, you name it. They go to physical therapy twice a week for a few months. They may start to feel a little better, but months later, their knee still doesn't feel right. Their knee still doesn't feel 100%. And then the doubt starts to creep in. They start to think, did the surgery even work? Why is my knee still hurting? Why am I still having pain with the same things I did before surgery? Why did I get the surgery in the first place if it's still going to be painful? Did you do something wrong? Is this just my new normal? Am I going to have bad knees for the rest of my life? If any of this sounds like you, if you've thought any of these things, drop a yes in the comments, drop a me in the comments, because in this video, I'm going to break down exactly why this happens, because it's not uncommon. Surgery alone is not enough. Thinking just because you have surgery, your knee is now going to be pain free is like expecting to get stronger just based on the fact that you have a gym membership, but you never work out, right? It doesn't work like that. Surgery is the same thing. The purpose of surgery is to fix structural issues. But here's the thing, it does not rebuild the strength that you lost due to surgery, or maybe the strength that you never had, right? A lot of times when we have knee pain is because we have a lot of weaknesses in our knee musculature, and that's putting a lot of stress on our knee joint. If we don't address it over time, that pain gets worse and you continue to have these unnecessary forces going to your knee joint, and that is what makes the pain persist. It becomes a cycle. So surgery doesn't fix that. It doesn't restore your strength automatically. It also doesn't improve your knee's ability to handle load. So it doesn't improve your ability to put a bar on your back and squat. It doesn't improve your ability to walk down the stairs. It doesn't improve your ability to hold heavy weight and go up and down stairs, do lunges. It doesn't improve any of that. It just sets you up to be able to do that in the future if you take the right steps. It doesn't automatically restore your knees full function, right? And then it also doesn't fix bad movement patterns that you have developed over time. Because if you have knee pain for a long time, your body is going to do whatever it needs to in order to not experience that pain. And what that does is makes us move in ways that aren't optimal and in ways that put a lot of stress on expected areas of the body that the body would not normally have to withstand and handle if we weren't in pain, right? And if we moved correctly. And that's where so many people go wrong. They go to PT for a couple of months, then they stop and assume they're done. And then they wonder why their knees still feel weak. It feels unstable. It feels painful. They're still having the same symptoms that they had prior to surgery. So when they try to do normal things like squatting, lunging, going up and down stairs, running, getting back into their training, all of those things are still painful because surgery is not an ultimate fix. It's just step one. Just because you had an ACL reconstruction or you had a meniscus repair, it doesn't mean that you're ready to jump right back into running or playing tennis, heavy squats, heavy lunges, all of these things. It does not mean that you're ready to do that. There's specific criteria that you need to meet. There's specific things that you have to be able to do, specific milestones you have to achieve before you can even think your body is ready to do this, right? And this is where people get misled, because you'll see that, say if you had knee surgery, you'll see that your doctor, your surgeon clears you to do these things, but they're clearing you based on how far out you are from surgery. That clearance is based on healing. So if your surgical site, the surgical tissue is repaired, is healed, is determined based on that, but it's not clearing you based on whether your body is actually strong enough to do those activities without compensating or without being at increased risk of another injury or getting re-injured. So really, if time alone was the only thing that you needed to be cleared, then why wouldn't people just sit around, wait a couple of months, and then suddenly be ready to run again? Suddenly just start running without doing any prerequisite work. That's not how it works. That's why you see athletes who get hurt, they take extensive steps in order to prepare to get back to their sport, because there's certain things that you need to do in order to be pain free again. There's a stepwise process that you have to go through. But people tend to skip these steps, and then they wonder why their pain is still working. I mean, still there, and their knee is not working the way it should. It's kind of like you never send your kid to any schooling, you never educate your kid at all, and they go through life 0 to 18 years old, and then you put them into the real world and you're confused as to why they can't read and why they don't know how to communicate and why they don't have personal skills. It's because you never worked on it. It's the same thing with your knee. Say if you had a knee replacement and you want to ride the bike, you could technically do that at week 1 or 2. But if you don't have enough knee flexion, so the ability to bend your knee and get your knee around the bike in a full revolution, are you going to do the bike just because you're cleared to do it? No, because you don't have the prerequisite of knee range of motion in order to successfully do it, despite you being cleared to do it, despite it being appropriate for your protocol, right? So that's something to think about. Then if you had an ACL reconstruction, and I keep mentioning ACL reconstructions because I know a lot of people who follow me have either had an ACL reconstruction in the past, or they're rehabbing from one now, or they have one scheduled coming up in the next couple of months. So the earliest clearance to be able to run with the ACL reconstruction is 16 weeks or 4 months, right? But before you even think about it, you need to be able to tolerate knee over toe positions without pain, without compensation. You need to be able to land on one leg with good form, without collapsing, without having pain, because when you run, it's literally just a series of single leg landings repetitively without, sorry, my series on. All right. It's just single leg landing repetitively at a fast speed. But if you can't land on one leg and not have pain, what makes you think you're going to be ready for running just because you're 16 weeks out, right? So that's a milestone you have to hit. You also have to look at things above and below the knee. You're not going to be able to run with good form and without compensation if your glutes are weak, if your calves are weak. Those things need to be in place. Then when it comes to lunges and squats, things people want to use to develop their legs, develop their glutes, and get strong, before you do these things, like for example, before you do a forward lunge, you need to be able to do a reverse lunge first without pain, with good form, load it up, right? Before you attempt to do a Bulgarian split squat, so a split squat with your back leg on a bench, right? The things the girls love to build their glutes and their quads. You need to be able to do a regular split squat with your back leg on the floor, with weight, with good form, without pain, without compensation. You need to be able to do these things. But a lot of times people make the mistake of skipping these steps or just assuming time alone means they're ready. And that's when the knee pain becomes persistent despite the fact that you had surgery. So if you're months out, years out from surgery, and your knee is still not where you want it to be, it's not too late. There's definitely things that you can do to work on it. But the biggest thing you can do right now is realize that you don't need more time. You don't need to wait until time passes and hope that your knee magically feels better. It ain't gonna work. All right. Unless you want to just go through your day and just get out of your car, walk up and downstairs, do regular stuff and not really be active, then sure, your knee will be okay with time. But if you want to be strong, you want to feel like an athlete again, you want to be active, you want to be able to do things without limitation, you need to have a plan that addresses your specific deficits right now. It's not going to be just up to time. You need a plan that addresses what you need to work on. So if you don't have full range of motion right now, then that's something that you need to put into your program. If your range of motion is great, but you can't tolerate any loading, so if your knee hurts anytime you try to go into positions where your knee goes over your toe, then you need to gradually build up your strength and your control so that you're able to tolerate that. And that will translate to you being able to do the things that you're now having pain with. And that's what I focus on inside my Get Rid of Your Knee Pain program. So if you're ready to rebuild your strength in specific positions, fix any imbalances that's limiting you, and train without limitations or worrying about your knees, grab the Get Rid of Your Knee Pain program inside the description. If you're watching this on Facebook, it's in the comments. Also, if this video helped you, be sure to press the like button, Make sure you subscribe because I will be posting more knee pain specific videos, and share this with someone who's been dealing with knee pain that's been limiting them from training, because there's a lot of information out there that is not right for lifters, and that's what this channel is all about. With that being said, I'll catch you guys on the next video. Peace.